Dr. Mobeen Rathor from UF Cares is here to speak with us about HIV/AIDS research, education, and services. Welcome, Doctor. Thanks for joining us today.
Thank you very much for having me.
It is our pleasure. So what does UF Cares do?
Well, as the name suggests, it's the University of Florida Center for HIV/AIDS Research, Education, and Service. So it sort of covers the whole gamut of things that we do here in Jacksonville.
So, but you were telling me off air that there was some pretty significant announcement yesterday. Can you tell our viewers what that's all about?
Yeah, it's very exciting that a new medication was approved for children that will become available hopefully soon before the RSV season. This is a medication that will help prevent RSV infection in children, infants and children. As you know, in the last two seasons, or last 2 years, we have had some terrible RSV activity and a lot of kids getting sick, hospitalized, and dying.
Wow, that's pretty significant. So
yeah.
that should save quite a few lives, right?
Oh, absolutely. And we have something right now, but this isn't much improvement on that. So I'm hoping we'll hear more about it down the road.
Excellent. So how is UF Cares different from other HIV programs in our area?
Well, UF Cares is unique. First of all, it's the oldest comprehensive HIV program in North Florida.
Oh, wow.
North Central Florida, I should say. And, there are other programs, but we are the only ones who take care of infants, children, and adolescents.
Oh, wow.
We are the only ones that take care of pregnant women.
Really?
So I think it's unique in that sense. Also, we are the only center that we can provide access to National Institute of Health research, the latest and cutting-edge research for vaccines, for treatments, and lots of other things.
That's wow. So you kind of touched on what else makes UF Cares so unique. I mean, the working with pregnant women and children. There's not other facilities that do that. You guys are the only ones in the area.
Right. There may be some other here and there, but definitely for pregnant women, but nothing for infants and children. We are the only ones who take care of infants and children.
Wow.
So I think the program really serves all populations, all ages, but those are the specific populations we not only serve but also focus on.
So does UF Cares do outreach?
Yes, so we have a couple of mobile vans, so we're very excited about them. They go out, we are out in the community every day. We provide HIV testing and screening, and we also provide hepatitis C testing and screening, syphilis testing and screening, some other sexually transmitted diseases. But also, I think we have a very unique program. It's also unique to us is we go out and test, this is all through grants, test women of childbearing age, both for pregnancy and HIV infection. So we find women who are pregnant and not HIV infected, we are able to refer them to whoever takes care of them.
Yeah.
Or if they are HIV infected and pregnant, then we can see them for that. And that's very important because one of the things that we have been doing since 1994 in collaboration with Dr. Delkey and the OB group at UF Health is that we have a protocol where we give medications to the pregnant women and during labor, during pregnancy, during labor and delivery, and then we give it to babies. And since 1998, we have had no HIV-infected baby born to HIV-infected pregnant women if they were part of our program.
Wow, no way, really?
Yeah, that's the most I always tell people that's hopefully my salvation. The transmission rate was 25%. So if you think we had about 100 infected women every year, so you can imagine from 98 now how many babies are not HIV infected.
Wow, that is impressive. How does that work? How do you manage to keep the child from being infected with HIV if the mother's contracted it?
Right. And the first thing is I think you say how does this happen? This happens because UF Health has a commitment to this.
Yeah,
this is very expensive to do, but our UF Health and University of Florida leadership has committed to this. And so the way we do that is we give the medication to the mother, so her virus comes very low. Then during pregnancy, then we give labor and delivery, so any virus that may be in the system gets even lower. And then we give it to the baby. If the baby by chance got any virus, won't have the infection.
Wow.
So that's, I think, one of the most important things that I think UF Cares does.
That is fantastic. That's super impressive. Thank you so much for being on the show today.
Thank you for having me.
I learned a lot today. That was really great.
Thank you.